All right, so anyway, we're going to talk about blood today. Yay? Yay. So first thing that we need to do is, again, these are the objectives. These are what you're using for studying for your test. Questions? Oh, good. Okay. The reason I have this components of blood, which you guys are probably already familiar with from prior classes, is that just to remind you that we're going to have red blood cells, like when we're talking about different kinds of anemia. Some of them are going to be normal sized, okay? Sometimes we're going to have an anemia where you're going to have really tiny red blood cells, okay? Sometimes you're going to have an anemia where you actually have large blood cells, and that's where people get a little bit confused. Because if you think back to blood and how it's formed, you might remember that there is a blood stem cell, and it can either go down a myeloblast side or a lymphoblast side, and then if it goes down the myeloblast side, then that's where eventually your red blood cells are going to be formed from that myeloblast. And it's also making platelets and other things, those granulocytes. But the point is that sometimes you will have a red blood cell that's really big because those myeloblasts are really big. Okay? Does that make sense? It's an immature red blood cell, even though it's really large, because they start out large and then they get smaller. Okay? So we'll look at that later. Do need to know the polycythemia, many red blood cells. I don't know if we talked about that or not before, but things like blood doping would be an example of a kind of polycythemia. Obviously, it's different. Polycythemia itself is a disease where you just have way too many red blood cells. That's not an anemia, but it is definitely a blood problem. Okay? We are going to look at anemias, A-N, and without or less than emias. Okay, so we'll look at those. So here's a question for you. If Edward Cullen was to suck out all of your blood, how many 1 liter water bottles could he fill up? I'm not sure what that says, but I'm going to say yes. Okay, ready, set, go. I can't tell. The screen is too dark. How many have you answered already? This should be pretty fast, so can you see it?
No. 9.
I don't think
Really? You can see that?
Yeah, Rachel.
Dang, Rachel.
Ooh, Rachel's got super eyes. You're like a superhero.
Thank you.
Okay, what's our count, Rachel?
13. 14.
15.
Not all
17.
heroes wear capes.
Oh my gosh, Rachel.
What are we up to? X-ray girl.
19,
20.
Ooh, got a couple of them. All right, so if you haven't answered by now, you apparently don't know, so let's just move on and see what we got here. We have 4, 4, 4, 6, 6, 7, 9, 8, 8. Ooh, look at somebody's got all sorts of weird details on here. 20. 20. Somebody put 20. I will find you.
And 22.
Whoever you are. Okay.
22.
22.
All right, whatever. We will accept somewhere between 4 and 6 because it does depend on the size of the person, but it should be somewhere around 4 to 6. Okay? So, anemia, like I said, you don't have enough blood. Red blood cells, that's what we're talking about. Okay? If you do not have, and this is kind of key, if you do not have enough red blood cells, of course, you already know, they carry oxygen, which means you're going to get a lot of clinical symptoms from not enough oxygen. Okay? And you get tired because of the oxygen deprivation. Says key, wrote key, there's a key. This is a key point, okay? You need to know this, and this is the part where I wish my stupid pen would be working, but sadly it is not so. I just need to talk about it. Okay, when we classify blood anemias, you're going to look at these two factors. You're going to look at their size and then look at their color, okay? So a size, as in normal size, normal cells, normal cytic, that's just a normal size red blood cell. You can have anemia and still have normal size red blood cells, okay? On the other hand, you can have anemia and you can have micro or tiny, small red blood cells. Different kind of anemias. Macro, again, different kinds of anemias, but now you have really big red blood cells, kind of like what I was talking about earlier. Yes, ma'am?
So I thought anemia was defined as the decrease in red blood cell mass. So how would macro fit into the anemia definition?
Aha, that's a good question. She says anemia is strictly defined as a decrease in red blood cell mass. So she's like, well, if you got a really big red blood cell, how is that possibly an anemia? The answer is because, well, two reasons. One, you do have less of them. So the ones you see are big, sure, but you have less of them. And I don't know if they necessarily call it when they're looking at the mass. They may not measure the immature red blood cells that are kind of worthless anyway. I'm not positive about that part of it, but in either case, you do have less red blood cells, or at least you have less healthy red blood cells. Okay, does that make sense?
Yeah.
Okay, good question. I don't think anybody's ever asked that out of, geez, I bet I've been through a couple thousand students, at least. Oh, that's easy, yeah. Yeah, forget it. A lot more than that. About 400 every semester. Okay, so the other thing we look at is color. Okay, now they are going to be either normal color and one of these, right? Normocytic, microcytic, macrocytic. Could be normal color. Not so much the microcytic, but we'll get to that. Or it could be hypochromic. Okay, hypo, pale. Okay, not as red as they should be. Now that hypochromic is typically what you link with the microcytic part. Okay, so you'd have a cell that we described as microcytic and hypochromic. Anybody happen to know what that would look like, or what kind of anemia causes that right offhand? This is going to be on your homework and everything, but anybody happen to know already? Yes?
Cyanosis.
It would cause cyanosis. Actually, any of these would cause cyanosis. That's just like a blue tint to your skin because you're oxygen deprived. The specific kind of anemia, though, that typically goes with a hypochromic and microcytic is the most common, which is the iron deficiency anemia. Okay. On the other hand, you will see some macrocytic and normochromic. Notice there's no macrochromic, hyperchromic, anything like that. The reason behind that is, think about this, which is why I brought up the iron thing. Think about that. If, again, don't quote this to a PhD physiologist, he'll probably come and hunt me down to do awful things to me, but I think about it like this. You need iron to make hemoglobin, okay? I picture iron as like iron, you know, like the iron bar kind of thing, right? And so if you take your iron and you make these beams, like construction beams, well, the hemoglobin would be like the framework of a building, okay? So I picture the hemoglobin as a framework of the cell made of iron. That's why if you have iron deficiency anemia, you're going to have smaller red blood cells because you have enough iron to make the beams to make the structure of the cell. Does that make sense? Okay? On the other hand, it's also going to be less colorful if you have an iron deficiency anemia because hemoglobin is what gives red blood cells their red color. Okay? So if you have less hemoglobin because you had less iron, then you'll have pale red blood cells. Okay? But where I was going with this is you don't have a hyperchromic. Why? Because if you think about it, that framework is still the framework. Okay? So if you take a bunch of those frameworks and put them in a bigger cell, yeah, you're going to have more of those frameworks, but they're still going to be the same density. Does that make sense? Or not? So you can have small pale cells, but what you can't have is really large, overly red cells, because despite the size of the cell as it gets bigger, you still can't put more and more and more hemoglobin in there so that it makes it more concentrated, because the framework just kind of runs into each other. So it can only be so dense. So it's just always that dense. So it's normal color, even though it might be a really big cell, it might have a lot more hemoglobin because it's a big cell, but it's still the same density as the normal size cell. All right? We might get back to that later. So if you're looking on a lab test, that lab test is not going to tell you necessarily you have microcytic, hypochromic, or normochromic. You know, it's not necessarily going to tell you that. You have to just kind of figure it out, because what it'll give you is things like this: MCV, mean cell volume. Okay, mean is average, of course, numerical average. So it's going to take the mean cell volume and look at that, and that is going to tell you what, as far as that micro, macro, normal, all that stuff. What's a mean cell volume going to tell you, as far as any of that, either size or color? Size. Yeah, it's going to give you the size, the relative size of a blood cell, okay? It's taking the average of all those red blood cells in the blood sample that you gave them, and it's just saying this is the average size. They're measuring on volume, of course, because, you know, red blood cells are holding things in them, okay? The other thing that's kind of important for you to know is MCH, mean cell hemoglobin, the average mass of hemoglobin in each red blood cell. Okay? Again, that's going to tell you either don't have enough or you have normal amount. Okay? You're not going to have too much. So that's going to tell you your color is the MCH. Still with me? Sure. Okay. All right, so the MCHC, again, pretty similar. So I wouldn't worry too much about that. I mean, it's more or less going to tell you the same thing. I wouldn't stress about that right now in your lives. Same kind of thing with RDW, the red cell distribution width. It just gives you the, you know, how much variance you have in the size of your red blood cells. But again, you probably don't need to worry too much about that right now. Okay? What you really need to know is, number one tells you if it's normal, micro, or macro, and number two will tell you if it's normal or hypochromic. Questions on any of that? All right, we're moving on then. These are general signs and symptoms of anemia. All right, so let's go through them. Most of them are going to apply to any kind of anemia. Okay? And there are a lot of different kinds of anemia, which you will tell me all about on your homework assignment for this week. But most of these are the same signs and symptoms. Okay? So you're going to be tired, weak, dizzy. Why? Because you're out of oxygen. You're low on oxygen if you have anemia, right? It's going to make you tired, weak. Okay? It's also going to make you pale. Not like that, but, you know, pale, nonetheless. Why would you have shortness of breath and dyspnea?
Less oxygen.
Less oxygen, right? Same answer over and over again. How about chest pain, arrhythmias, tachycardia? Less oxygen for the chest pain. Remember, heart doesn't do anaerobic respiration. You don't give it oxygen, it's going to die. Okay, and it'll set off those pain signals pretty fast when it starts getting low on oxygen. It's also going to pump faster because you have less blood, less physical fluid in your body when you have anemia. And therefore, it has to pump faster to get that around to all the cells of the body. Okay? Anybody know what orthostatic hypotension is? Yeah, you stand up, you get lightheaded or dizzy, that's syncope, you might even pass out. Okay? Why would you do that if you had anemia? Yes?
Because you don't have enough oxygen, it's like this part, it's like
okay.
When someone goes into shock, you always tell them to put their feet up so they get more blood
okay.
up here-ish.
Up here-ish, yes, up there-ish. Good. So yeah, again, it's the same answer, right? You have less blood circulating in your body, so if you stand up too fast, gravity alone might pull that right out of your head, and before your body can react to that less blood and constrict everything to stabilize it out, you might pass out. Okay. Cold hands and feet. Why? Blood's warm. Okay. Less blood, less warm. Or they crank the AC like they did in here. Nail changes. We'll see that, and we'll look at that. But that's more specific to, anybody know what kind of anemia will actually cause you to have like spoon nails and things like that?
Is it like B12 or biotin type?
No, not B12. That has other issues, but not the fingernails. The fingernails, you see that a lot, like in older people, like geriatric care centers, where they get like spoon nails, they call it. Anyway, we'll look at that. Okay, but that's like a iron deficiency thing usually. All right, decreased growth and development. That's for any kind of anemia if it happens to have its effect when you're just a little wee lad. Why would that be, by the way? Why would you have decreased growth and development if you have less blood?
Production of your bones in early childhood. That's when most of the bone production occurs.
Okay.
So if they're not producing the red blood cells, there's going to be less.
Less growth?
Yeah.
Which is, are you a lawyer? I think you just talked in a circle. I'm not sure. But yeah, obviously if you have, less bones, could obviously make less blood, but if you have less blood, you have less oxygen again. And if your body already doesn't have enough oxygen to start with when you're little, what's the incentive for it to grow any bigger, right? It's kind of like those, turtles or whatever. You put in a little small tank, it only grows as big as a tank. It's kind of like the same thing, right? So yeah, you could have like a failure to thrive because of a chronic anemia. Not that happens a lot, but, at least not in the U.S. At least not in the U.S. and more affluent places, I guess. Okay, neuro, as in neurological signs and symptoms, you're only going to see that one in vitamin B12 deficiency. Okay, as in pins and needles, tingling, paresthesias, whatever you want to call it, you have nerve issues, even pain, with vitamin B12 deficiency anemia. Okay, we'll talk about that in a minute. Any questions on any of those signs and symptoms? Like I said, most of them, the vast majority, you're going to have any kind of anemia. There's a couple things that are different in like vitamin B12 and iron deficiency anemia. Okay, so some causes, obviously, if you lose your red blood cells, right? Duh. And that can be acute or chronic, by the way. Okay, acutely you can, get stabbed, right? Obviously you're going to lose your red blood cells. And then if somebody decided to stick a needle in your arm while you're gushing blood out of your abdomen, then you'd have less blood, comparatively speaking, right? So that would be a normal cytic normochromic because it hasn't had time to react and do anything with your blood. Chronic, on the other hand, you could have a chronic blood loss. How would you possibly have a chronic blood loss and not notice that? Wouldn't you think you'd notice if you were losing blood over a long period of time?
Internal bleeding, or like girls that first start their menstruation, usually it's irregular, so they lose a lot of blood that way.
Okay, is that what you're going to say?
I was thinking about like hemophilia, like internal bleeding.
Yeah, hemophilia, absolutely. And what you said too. So yeah, you do see more chronic blood loss probably in females just because of that whole menstrual cycle thing. You're literally losing a lot of blood every single month. Yes, sir?
Trauma, just like in general.
Trauma? Like you get beat up a lot or what? Because we moved on to chronic. Huh?
Crash or something like that.
So are you chronically getting crashes?
Well, no, I mean like.
Are you back on acute?
Acute.
Okay, got it. Oh, maybe you were saying that somebody like, NASCAR driver or something. I get in a wreck every 3 weeks and lose a lot of blood. So. It could happen, sure. Yeah.
Are there conditions where the red blood cells are destroyed faster than they're reproduced?
Yes. That is called hemolytic anemia. When they're getting destroyed faster, they can be reproduced. Cool. Which is actually this one right here, number 3. Okay?
Oh.
Good lead in. Okay. But again, I kind of already mentioned the production issues. Any other questions on that? So really, I mean, you know, those are the 3 main ways that you can not have enough blood. Moving on. All righty, let's do that. So here's our acute blood loss again. Trauma, ulcers, okay? We'll talk about ulcers a little bit more detail a little bit later on. But you know, that's internal bleeding, right? So is hemorrhoids, you know, like in the rectum where you're bleeding out. Any kind of GI bleed that it can be acute, can be chronic. Right now we're just kind of talking acute. So some of these things, actually, other than trauma, pectic ulcer, hemorrhoids, and GIs, can be acute or chronic. Okay, it just depends on how fast they're bleeding. Okay, what's that word, HCT? What does that stand for? Anybody know? Exactly, hematocrit. Hematocrit. What is hematocrit? Hematocrit. Definition of. That's right, take your time. You'll tell me on your homework anyway. It is if you were to take a blood sample of somebody and measure the percent of red blood cells in that blood sample, that's what hematocrit is. That's it. It's just the number, or the percent, not the number, but the percent of red blood cells in a blood sample. Question on that? Okay. So normocytic, normochromic. Oops. Oh, good. A lot of people aren't looking. So if we have a acute blood loss, we're going to need to make more blood, right? What hormone is going to kick in to make more blood? For those of you that weren't looking, it is EPO or erythropoietin, right? So that's going to go, it's produced in the kidneys. It's going to have an effect in the bone marrow, going to make more red blood cells. And about a week after it kicks in, you're going to have increased reticulocytes, or ret count, they call it. So say, what's somebody's ret count? Okay? If somebody has anemia, they better have a high ret count, okay? Because that's what an immature red blood cell is. It still has its nucleus, okay? Which means you're making more, and that's a good thing, okay? If you do a ret count on somebody who has anemia, and the ret count is low, you know where the problem is, don't you?
Mm-hmm.
Okay? Now you got some serious bone marrow issues, and those are a lot more serious than just giving somebody a nasty vitamin pill or something, or iron pill, okay? Chronic blood loss, again, this is another example of what you're talking about. The rate of loss exceeds the ability to regenerate, okay? You're losing blood for a very long time. Usually we're talking about iron deficiency when that happens, okay? Because we tend to keep most of our iron in our body and recycle it. However, if you're losing the race on iron in versus iron bleeding out in blood, that can happen in a chronic, long-term situation where you're just a slow bleed. And if you think about it, if it's something internal in your GI tract, you know, some kind of an ulcer, whether that's in the stomach or in your intestines or colon, it's going to mess up your stool. I mean, the stool is going to be like black and tarry and smelly, but that may not be something somebody really takes that seriously and looks to get treatment for. Okay, so people can lose blood over a long period of time like that, chronic blood loss. Okay, obviously, like you said earlier, that could happen if you are having heavy menstrual cycles. or very frequent menstrual cycles, more than every 3 weeks. Okay. Could happen if you were having very infrequent menstrual cycles, but when you had them, they were like extreme. Okay, that happens like in polycystic ovarian syndrome, for example, where girls would just not have a period for 3 months, 6 months. Then when they have it, I mean, they're like laid out in the hospital kind of pain and bleeding like crazy. Okay. Okay, occult blood loss means hidden. Okay, that's what I was talking about in those situations. Hidden blood loss, you don't see it. So, microcytic hypochromic anemia. That means the MCV is going to be what? The MCH is going to be what? Oh, let's pick Megan Haley.
The MCV would be low.
MCV would be low?
Yeah.
What would the MCH be?
Low.
Very good. Low and low, right? Makes sense? Easy? Easy peasy? Questions? All right. Again, here's just an example of microcytic hypochromic. Small, pale red blood cells in the top left compared to the bottom right. Yes? Yes. Let's see if this works. For some reason it was not working earlier. Maybe it will now. Nope, it's still not. I don't know what in the world is going on. I wonder if it's a PowerPoint because they're 2 totally different computers in 2 totally different rooms where it doesn't work. I guess my link is probably dead there, but why I can't draw on it? I wonder if somehow I got to like an old format or something where you can't draw on the PowerPoint. Anyway, I'll have to look into that. So what's the answer here? Most likely result of decreased myelin. Is this question too easy? From too many classes ago? Myelin does what? Myelin does B. Okay? Myelin keeps you from having B, right? Because that's that coating that goes over the axons and nerves, right? Okay? So myelin, again, 80% of it's like lipid, like fat. Okay? And guess what? Vitamin B12 actually maintains that myelin sheath. Okay? Without vitamin B12, that myelin sheath can degenerate, can get destroyed, and now you start seeing nerve issues. Okay? Again, paresthesias, tingling, pins and needles, they call it all sorts of different things. But you start having nerve pain of some kind, unusual nerve issues. Okay? Now, if you have a macrocytic, as in really big, megaloblastic means the same thing. Okay? Sometimes you'll hear these macrocytic anemias referred to as megaloblastic anemias. Means the same thing. But when you hear that, you're pretty much talking about 2 kinds of anemias. Okay? Either vitamin B12 deficiency or folate deficiency. That's pretty much it. Okay? How do you tell the difference between B12 and folate? One of them is going to cause nerve problems and the other one is not. Which one causes nerve problems? If you don't have enough B12, because that's what maintains the myelin sheath. Yes?
Now, can B12 deficiency also lead to like CNS issues such as like memory loss and other dementia?
That is a good theory. You would think B12 deficiency could lead to memory loss and things like that. I'm going to say, sure. Not directly necessarily, but if it's maintaining the myelin sheath, then depending on where those nerves are going, why not? Okay? All right. So you'll have a B12. Oh, by the way, another word for that is cobalamin. You might hear that every once in a while. Okay, vitamin B12, cobalamin. And or folate deficiency. Now, both of them will do the same thing. Macrocytic normal chromic, not hyper, normal chromic. Okay? Again, don't get confused because it says right here, increased hemoglobin content, because the cells are bigger. That's not the same as increased hemoglobin concentration. Okay, give you a second to have that set in. Got it? Okay. Sometimes you will hear vitamin B12 deficiency called pernicious anemia. Okay, that's like it has its own name. It's very dangerous, means kind of like deadly, dangerous, serious. It's very pernicious. So they used to call it pernicious anemia. Still, people will refer to it sometimes as pernicious anemia. A lot of times when they're referring to vitamin B12 deficiency anemia as pernicious anemia, a lot of times what they specifically are trying to get out is you have a deficiency of intrinsic factor. What does intrinsic factor do? Yes?
Not the one for like blood clotting, or like blood clotting?
Blood clotting?
Yeah. Anyway, is it for platelets?
Maybe, I'm not sure. That's not coming to mind on its
Maybe I'm confusing it with something else.
involvement there. I'm not even sure what you'd be confusing it with, so you may not be. I'm not positive. The main thing that I remember about intrinsic factor is that you need intrinsic factor in your gut to absorb vitamin B12. Okay, so you can go ahead and chomp down a steak, has lots of vitamin B12 in it, and iron, by the way. You'll absorb the iron, but if you don't have intrinsic factor already there, and I want to say it's like at the beginning of the small intestine, ileum or something like that, but you're not going to absorb vitamin B12. Okay? So then a lot of people will say, well, he has a pernicious anemia. It's the same thing as vitamin B12 deficiency anemia, but because of lack of intrinsic factor, that autoimmune problem. Okay?
So if you have pernicious anemia, how do you, if you're not absorbing B12, how do they
get it to you?
Yeah.
Well, you can get B12 shots. That's an option. And
Like supplements?
I want to say that I thought they had some kind of pharmaceutical fix for not having intrinsic factor, but I can't remember it right offhand. I think there is, though. I want to say there is. But either way, you can, as a minimum, give vitamin B12 shots, and you'll take that because you give it right into the intramuscular, and it skips that whole GI thing altogether. Okay, good question. Celiac, irritable bowel. Notice these are GI disorders, and I was talking about GI disorders earlier about causing internal bleeding and chronic anemias. These don't bleed. Celiac, right? That's it. Celiac sprue, where you're not absorbing things, wiping out your villi, microvilli in the intestines, right? And irritable bowel disease. What these two have in common is things are passing through the GI system really fast, and they just simply don't have enough time to absorb everything, and sometimes what that is not getting absorbed is vitamin B12. Make sense? Okay. There are some drugs like metformin. Anybody know what metformin is? What it's used for? Nay? Okay. Metformin is a, do I have it on here? Yeah. It's a fairly common diabetic drug. It's something that's pretty harmless as far as any kind of drugs go. So a lot of people are on it that have diabetes. It helps control blood sugar. It's also given a lot for somebody with polycystic ovarian syndrome, and it can interfere with vitamin B12 absorption. Okay? But here's the problem. Think about that, like I said, somebody earlier mentioned polycystic ovarian syndrome. In what context? What kind of anemia? Roll. I mentioned that, yeah, like in the chronic, when I was talking about somebody losing a lot of iron because of menstrual cycles, okay? Somebody with PCOS can have an iron deficiency anemia because They lose a lot of blood when they do menstruate. Okay? Well, guess what? Sometimes they give metformin to people with PCOS because there is a relationship sometimes with having high blood glucose levels and having PCOS, even though they're not diabetics necessarily. Okay, so sometimes they'll give that because it also helps control their weight. That's one of the things with PCOS is you tend to gain weight a lot easier than other people. So sometimes they give them metformin for PCOS. Well, if they're having those heavy menstrual cycles, they could have iron deficiency anemia. And now they could also be at risk for having vitamin B12 anemia. So then they could have both. So again, it's something where it gets complicated real fast, where you got to start tracking this sort of stuff. Yeah.
Do they have treatments other than the B12 shot for the GI disorder to increase the absorption of nutrients?
That's what somebody else just asked. Answer is I think they do. I just can't remember right offhand what it is. It's Monday. On Tuesday, I probably know. Okay? Anyway, so, again, remember they're called megaloblastic anemias as well as macrocytic anemias. Vitamin B12 and folate, as you can see, methylfolate here, folate pool, DNA, vitamin B12 right here. They're both involved in this pathway, okay, of conversion, of hopefully getting rid of homocysteine and making methionine, that amino acid, right? Methionine good, homocysteine not so good. High levels of homocysteine are actually associated with cardiovascular disease. If you have high levels of homocysteine for a long time in your body, a lot of times that comes from like chronic inflammation, like you're constantly inflamed somehow. However, that's not really the point. The point of this is to just show you that vitamin B12 and folate will both end up giving you that immature red blood cell that's really big, and the fact that vitamin B12 does maintain that myelin sheath. Okay? So that's the only one with the nerve issues. Okay? Like I said here. You know the difference between spastic and flaccid paralysis? Wow, it got quiet in here. Okay? In either case, you're still paralyzed. And I don't know what this guy's shooting out of his little blowgun, but it's going to paralyze you. Okay? Spastic paralysis is literally what it means. Like you're spazzed up, you're all you're all tight, right? Like tetanus or something could cause spastic paralysis. You can't move, but all your muscles are locked up, and that's why you can't move. Okay? Flaccid paralysis is where you're just totally limp, right? Your muscles they're completely useless, and you're like, spaghetti noodle, cooked spaghetti noodle. Okay? Questions?
How long does it take your body to be able to come out of that?
Are you planning on paralyzing somebody?
No.
You're like, how long? I don't know. Come out of what? About, like if you have like a B12 or if you get shot with a blowgun?
You get shot with a blowgun.
Oh, see, it figures you know. I don't know. Oddly enough, I've never shot anybody with a blowgun with any kind of, what do they throw in there? Carrare? Something like that? Anyway, I don't know. Look it up. You got a computer. You can Google how long does it take to recover from I think it is Carrare injection from a blowgun. I don't know. Probably don't want to go around doing that to people unless you never know.
Maybe.
I guess. Okay, anyway. Folate deficiency. Here's where you can get folate. Okay? Good stuff. Beans, lentils, asparagus, leafy greens, spinach, collards, kale, which is not really food, but whatever. Fortified foods. Okay? They throw, speaking of fortified foods, they throw a lot of folate in like breakfast cereals and things like that. Because they're really worried about a young woman having, such as most of yourselves, having a folate deficiency. Why is that?
Pregnancy, if you were to get pregnant part of like a prenatal, like we should be taking folate?
Yes, it is a pregnancy issue. Does anybody remember, now that Kat has said that, other than Kat? Yes, you should be taking folate. It is one of those very important compounds in prenatal vitamins. But why is it so important? Yeah, Sam?
Because it develops the neural tubes in the baby.
Exactly. Without folate, when that spinal cord develops, it's not going to be able to close the bone around the spinal cord. And what happens is that spinal cord doesn't stay a cord, it becomes a big bulging mass of nerve and pops out of somebody's back, or the back of their head for that matter, can just be coming out because the skull never formed in the back. Okay? That's called what? Spina bifida, right? And spina bifida has a very, very, very large spectrum of how serious it is. It can be anything from, like spina bifida occulta, some kinds of spina bifida occulta is like, you don't even have any symptoms, okay? You might have a little soft, mushy spot in their lower back or something, but maybe not even that, maybe just a little tuft of hair, and you're like, what the heck is that little tuft of hair, right? Looks funny, but that's about it. On the other hand, you could literally have your nervous system popping out, you're crippled for life, you can't get out of a wheelchair, maybe you can't even get in a wheelchair, maybe you have to walk hunched over. You guys ever see that movie Shallow Hal, way back in the day? Shallow Hal, there was a guy that he kind of walked like this, he was all bent over the whole time. He had spina bifida, couldn't stand up straight, ever. Anyway, kind of a serious thing. That's why, again, they're going to chock our breakfast cereals and stuff full of folate. Go back and look on the back of the box, the more crappy the cereal, the more folate it seems to have in it. It's because they don't really want that to be a big issue in the U.S. So they're going to see if you can get if you're not going to eat healthy, then, hey, let's catch the people that are eating unhealthy too, at least give them their folate so they're not having a baby with spina bifida. Okay? Take a couple of minutes on this, like 2-3 minutes, and get in groups and talk about this, and then we'll ask you guys to explain, okay? We will pick a group at random.
Oh.